emphysema demekareti. If emphysema is present for several years, the patient could get barrel chest. أما بيقولون barrel chest. باشا barrel يعني أكو برميل ليه chest. ببيني شيء expand بو. لانجي أنا أنسان expand به full أبي وأكاكا ثوراسي شو دور ده أكشف. باشا there will be barrel formation of barrel chest. And this is pulmonary fibrosis. As we said, there is fibrous tissue in between the alveoli and in the wall of the alveoli that restricts the movement or expansion of the lung. Now we will come to another important factor that affects compliance, which is surface tension. Bir tane compliance yerleştirme indikatörü elastic fiber, peki Türkçe surface tension. What is surface tension and what is the effect on the surface tension? You see the drop of water. Why the drop of water or drop of rain is in this shape? What you drop your rainbow shape here? Our water, our step. Why should it drop? Due to surface tension. Well, zor başlar. Herkeşani der dilakan yani molecule, the water molecule, when in contact with air, there will be attraction in between them. So attraction between water molecule. The water molecule try to attract each other when there is in contact with air. How do I actually rakashe? Cat air contact kalagal hawaya. Water contact kalagal hawaya. Chibet. There will be attraction of water molecule to each other and formation of this water droplet. This is the surface tension. Why we discuss surface tension? Is there any fluid inside our lungs or inside our alveoli? Yes, there is a line of fluid inside our alveoli. And these fluid molecules will attract each other. Only line fluid, zor penta, fluid zor kana. They attract each other. So this will cause what? Create a tension. When you tension, you understand. Allah, alveoli chile kat. Collapse kat. Zor baş. Kat o baş ya khraba. If it is not good or it's a bad thing, why we have it? Why we have this layer of fluid inside our alveoli? It causes surface tension. So خوی خراب نیه، باشتک باشه ولی باشتکش خراب. ولی خراب اگه چهره اگه مشتکی ترسش واسه. So it is good to have surface tension. Why? In order for lung to recoil easily after inspiration. تو هناسه که فوق هم نجیوه. كاتك هناسه ایتوا. The alveoli should contract or decrease in size or return to its normal size. چون expand this line of fluid is very important. Attraction of the fluid in the alveolar inside of the alveoli. These fluid attract each other and cause decrease in the size of the alveoli or return the alveoli, cause recoil of the alveoli. So this surface tension is very important for recoiling of alveoli during inspiration. Balan خراب بوتمان لعادين بيتوي it could cause collapse. Boy collapse هنا أبد شي هبت surfactant بانه. So we need a surfactant. Surfactant مادة proteinia. It's produced by a type of the alveolar cells inside alveoli. Surfactant molecule is very important to be present, and every one of us we have surfactant in our alveoli. If a baby delivered early, the baby could have deficiency in surfactant early, يعني prematurely delivered. من هذا الزول ده يبقى كش كانت يخوي. Surfactant كما بطلتي develop نبوة. What will happen to the lung? There could be collapse of the alveoli, and it's a very severe disease if it is not treated. So surfactant is very important. What is the function of surfactant? It decreases surface tension. So we said surface tension is important, but it's not be so high to cause collapse of alveoli. A base self-extension man happen for recoil of the lung. Self-extension is important. It makes the recoil of the lung to be easy. But if it is too high, it causes collapse. To prevent collapse, we have surfactant. Saying surfactant molecule, how surfactant molecule decrease self-extension. Besides which self-extension, absorb the collapse lung. We have a law which is called Laplace law. Laplace law, you may hear about it or you will hear about it later in the cardiovascular, not after the cardiovascular jargon. The circulation شائع خيالين بلام in the circulation or in the cardiovascular, the tension is different. When we say tension, we mean by another thing. يعني لنعكس مقطع tension شتيك غير tension شتيك ترى. لبرا استباسي respiratory. This is the same law, but when we say radius or tension here in the respiratory is different, in the cardiovascular is different. ليرة شي معناها؟ إما سفيرة معناها. أم سفيرة بزانين آية Laplace law شون تطبيقها بالسري. We have inflating pressure, we have self-extension, and we have radius of curvature. Inflating pressure يعني شي؟ The pressure that needed to inflate that alveoli. شي pressure يكمان أوي؟ بوي أو alveoli inflating. Self-extension ما باسكت. The attraction of fluid molecule to each other that cause decrease in the size of alveoli. Radius of this sphere. Radius أكيد. يعني alveolar volume كsize أكيد كان alveoli. بتشوفها دورية radius أكيد كان. So according to Laplace law, the pressure necessary to keep the sphere open is proportional to the self-extension and inversely proportional to the radius. P here, inflating pressure. T here, self-extension. Hoi tension later, but I'm like, I'm respiratory balance, self-extension. R here, radius. Say again, inflating pressure, peristeam. But here, the inflating pressure, and image كاتب يسمى بويك inflating pressure زيادة بعرف شو بتعمل. Where we need higher inflating pressure. طبعاً higher inflating pressure يعني بيسمى ب force contraction muscle زيادة، بيسمى ب work زيادة، إشي زيادة. أنا نسيت قلت له. كيف بيسمى بويك inflating pressure زوربة؟ كاتب self-extension زورت بينها. They are directly proportional. So more self-extension, يعني شيء more attraction of the water molecule, try to decrease the size of alveoli, so it needs higher inflating pressure in order to make it inflate. To make alveoli inflated, we need higher pressure because of self-extension. When self-extension is high, the inflating pressure will become high. What about radius? Radius بتشوف به. يا قولي باشتريها. بلى؟ شو؟ زور باشا. تاكو ريديس بتشوف به، تاكو الجولا كمان بتشوف به. في ريستي ببريشريك زور تبيت أنا كمحمد إسماعيل اللي ربوت وتم اشتكي كان بيت إكسرسايز تشيبو. مثلاً بالونك inflated but يعني راكبة طاي امتينا كالبشرة لأيه تامامه. And we say the one with larger size can easily be inflated than the one with smaller size. وأنا بيرتانا أو ده كاتك بطالبو هوايتي كاب تشوف تلبو يعني كسايزة كيف تشوفو زحمة تر هوايتي تشوف يعني بيسي بإنفليتي بريشر زيادة. أو هالبوي أو تعمل بمعنى the smaller the alveoli need higher inflating pressure to make it expand. Okay, so Laplace law said that the inflating pressure is directly proportional to the self-extension and inversely proportional to the radius. كشيء معناه جانبات surfactant ناكد. If we do not have surfactant, what will happen to our alveoli during full expiration? Full expiration شيء وقوجون هواء كي بالونه. بعزت أنا برسالة أنا بتان active passive expiration جوازية. passive بتوانا كتي normal breathing لكتي رستا. active expiration or full expiration during blowing a balloon, during commonly to push away, and sighing or blowing extinguishing candle to agree بكوجين دوم هم بكوجين دوم يفوي كقائمة بيرستا باشا هواي كزور أبكي تدبر full expiration. What will happen during full expiration? What will happen to the sides of alveoli? Chilea alveoli كمان. Expiration. هوا قد كردو تدر. ريكويلا به size chilea بتشوكا بيتوا باش. size بتشوك بوا. كsize بتشوك بوا يعني البلا كمان بتشوكه كواتا بيستي ب higher inflating pressure or lower inflating pressure in order to keep it expanded. higher inflating pressure صور باشا كواتا احتمال collapse زورة يا كما زورة. So there is greater possibility to become collapsed this alveoli. أما إذا كانت جاء full expiration. وإذا كانت ريدس جيليا بس ما كروب زمري بس كمان بس التنشن ما نكر تنشن هي تيجي surface tension كان زورة به وش زورة به very good. The water molecule become near to each other and more attraction. كاتا attraction water molecule كان إيش زورة به كاتا there will be more surface tension. So how our alveoli will not collapse during full expiration? But you collapse naka because we have surfactant that decrease surface tension to prevent collapse. Okay, so we have surfactant, which is an important molecule present or formed inside our lung, inside our alveoli, to prevent or decrease surface tension, so prevent collapse of alveoli. Surfactant is very important. Stabilize size of alveoli, which is stable yakana, and size alveoli can ishman jawazi hebe. We now have a cat during full expiration, or estabas marker. But man chile full expiration. But man size بتشوكه beto tension زيادة كذا احتمال زورة collapse there because it need higher inflating pressure, and during expiration we have low inflating pressure. But when we have surfactant, it prevents this. How it prevents this? So surfactant prevent yoaka. Surfactant will go in between water molecules. أجد بين water molecule كانوا. كشو بين water molecule كانوا. يعني it will or it cover the fluid lining, so it go between air and fluid lining of the alveoli. بس طبعا emoteman fluid man هي لقل air surface tension بيستكع شو water molecule كان يكتر أكيشن يا شريك زور بيستكع بلام كده surfactant هات بينه when surfactant come in between them what will happen? The surfactant air interface has less surface tension than fluid air interface. يعني surface tension is surfactant كده كلاقول air contact air أبغى ما شو surfactant molecule كان شغلين يكراكش باشا بلام كم تيجا وقت لويكا fluid. When the fluid is in direct contact with the air, there will be more surface tension than when we have surfactant. So surfactant will go between the water molecule and prevent its attraction or decrease the water molecule attraction to each other and cause decrease in the surface tension. So it decreases the surface tension when the radius is decreasing, while it increases the surface tension when the radius is increasing. يعني شيء in comparison to normal طبعا. إما نستابلايز سايزك إهلا طبعا. أو ما باسكت طبعا. وقتي كالفلاي كبتشو كبتو تشيله surface tension زيادة. وانيا بلام surfactant هذا تشيله. بلى surface tension هذا تماماتوا. A basha bochi increase surface tension when the radius is increasing. How to do that? أو منظري من كبتشوف جوا surface tension شيء هكا أما كاتواي. نما ولا بيني water molecule كان nail attraction zorbe decrease self-extension. But why the volume is increased? It increases self-extension. How it increases self-extension when the size of alveoli increase? Very good. The number of surfactant for the water molecule or for the size of the alveoli decrease. The surfactant molecule will become far from each other, so the water molecule will have more chance to attract each other. When the alveoli expand, we will repeat again, when the alveoli expand, what will happen? You have an alveoli that expand. Ama alveoli, we can compare these two. Bajari bikasiri ama bkanwa. Amachia alveoli without surfactant. When the alveoli become small during full expiration, what will happen? There will be decrease in the radius of this and increase in the surface tension, so there could be possibility of collapse. Do alveoli initiate here? The air from this alveoli could go to the air from another alveoli. The smaller one will become collapse. So there will be collapse of the alveoli. But what will happen if surfactant present? It stabilizes size of alveoli, make them stable, prevent greater recoil or collapse during full expiration, and it help expansion during decrease expansion during full inspiration. Lakati inspiration is zora naale ona gore be corruption basha. Kata chilega stable yaka. So when the size of alveoli become increased, surfactant molecule become far from each other. When it become far from each other, water molecule will have chance to attract each other more. So it increases surface tension. Nahela batati or nazor inflate rupture. Of course, if we have normal amount of surfactant. هذا السيدي أوكل ليه alveoli smaller surfactant molecule كم زيكا. So what will happen to the surface tension? Decrease more. One year, surface tension, there will be greater decrease in surface tension. But when the alveoli become large in size, what will happen? The surfactant molecule become far from each other, and water molecule will become appear the water molecule and attract each other. So water molecule. So it will try to increase surface tension when the alveoli expand in order to prevent rupture of the alveoli. So the function of surfactant is maintaining alveolar size, make alveoli to become stable in size, and prevent collapse and prevent large inflation of the lungs. So what is the clinical point? We have an infant respiratory distress syndrome or distress syndrome. Acute respiratory distress syndrome is PLN. والله بعمل infant هاي. COVID لكوفيدا هر أمام بكرو زوربي. يعني there are several pathophysiology of COVID, but one of them, or the most important one that cause hypoxia, is due to this ARDS. ARDS, yeah? Acute respiratory distress syndrome. There is atelectasis or collapse of most of the alveoli. طبعا كوزاتي زوربو بس هيك كوزاتاني there are formation of mediator or COVID. Mediator that prevent the function of surfactant, or they decrease the surfactant action or function. Yani decrease the amount of surfactant. So surfactant is very important when it is decreased, when it is not well developed like in infant, or if by a disease like COVID it is decreased in amount or function, or any factor that interfere with its function cause alveolar collapse. And when most of the alveoli collapse in the lung is called atelectasis. Atelectasis means generalized collapse of the lung or large number of alveoli collapse. So deficiency of surfactant in an immature lung of some newborn infant, especially in premature, is the cause of the infant respiratory distress syndrome. Zani tamitwan surfactant chane sudi here. So deficiency of surfactant causes this disease. Why it's called distress? Because the patient or the baby will be in distress. There will be very difficulty in breathing. There will be collapse of alveoli. There will be hypoxia. بس كان كل وتمان كوزيك أو يكلان باش نكشيا كومبلانس كان بيت شيا هاورايك دان جابك زور جانيا وتي نيومونيا چون زور جراني ARDS و كوفيد يعني نيومونيا توشبه. If pneumonia is severe, it could cause atelectasis or collapse of the lung. And if there is collapse, it means there is difficulty of the lung to expand. كبزحمة expand يعني what will happen to compliance? Compliance decrease. So it needs high pressure change to expand the lung. So means the compliance decrease, less stretchability of the lung. Okay. Now, infant respiratory distress syndrome here. Seyri işlek kan esta di qad la işlek kan persarishtan lekan. Seyri between ribbikan zan shilea between ribs. Animation ba. Between ribs and beneath the ribs also. What will happen to it? Banawa acheha between ribs. Ay era second joanha. Abinin imagination in between ribs and beneath the ribs. Our here intercostal recession or retraction. Why did this retraction happen? Anyone could tell me? This baby has infant respiratory distress syndrome. يعني شيء collapse هي lung collapse كده so compliance decrease. التوقع بيبرر. كده بهذا. باش. Why retraction? Retraction شيء يعني dance كيلو اشتكانت شو كان بناوا أشياء. Why this baby has retraction, intercostal retraction? چی تعمینی اوت حسب چی اگر difficulty هی یا نه respiration has difficulty in respiration. Why there is retraction? چون تنظیم difficulty respiration هی بله. Yeah, this was طبعا collapse زورة إيه أوابد وجي. lung collapse كازور أوابد وجي. إيه أو كاري لung زور collapse كابو أبد وراس كأو يعني ميكانيزم كيتي بضام ليش لا بيتي. Why lung collapse cause this retraction? چی زوره؟ زور باش طبعا Selfestension زوره وای collapse شکن. زور باشه که او زور بو collapse بود چیه؟ Very good زور باشه دست باش آفرین. Attracti تشوکانکا. هم خما اوت با imagination پستکیو تشوکانی اکات ناو. بوچی آموزی مزین بو. زور باشه negative pressure سیدا. Baby here decrease compliance. The lung or collapse mostly. Most of the alveoli collapse كده. Go away. Volume lung زیاد پیسی با transpulmonary pressure یکی چون زورتری اکمتر لجارا. پیسی با pressure change یکی کمتری زورتر بیکا بوی volume زیاد زورتر ونیا چون compliance کمی کرده. Lung lung alveoli collapse need higher transpulmonary pressure, need greater pressure change in order to expand the lung. Bash, kata chiaka. Muscle expiration and inspiration, extra accessory muscle will contract. Accessory muscle can contract younger. How long cheap can? They make more negative pressure. In order to try, they make larger lung volume. Try to make more intrapleural pressure difference in order to expand the lung more. But can they do that or not? They try to expand the lung more. They can do it for some extent. They cannot do it completely. Why? Lung expand can? Because it's collapsed. There is very high self-extension. There is less surfactant than normal. Follow Echiaga. أو negative pressure man هذا. نيتواني بطاطي لان راكشة. أي شيء راكشة دوركي. شيء راكشة. تشوكان راكشة. تشوكاني دوري كاتا in between ribs. Kata we have accessory muscle contraction for deep inspiration and expiration, and there's large negative pressure that produce and cannot expand the lung more like normal, so it attract the tissue in between the ribs. Kata shwakani بين ribs راكشة لجاتي ويكنات وانا lung راكشة. So this is all due to negative pressure, and this is the effect of surfactant. Normally surfactant produced at 23 weeks. دستكابة الرجبون. والله أنا بستوهش وسيمبوليكا وطاي طواو أبد. That's why premature baby could have this disease due to deficiency in surfactant. We will come to another important subject, which is airway resistance. Airway resistance there is resistance to airflow. Resistance to airflow. For air to move through the airways to our lungs, and resistance it's better to have less resistance. If the resistance increases, what will happen to the flow of air? It will decrease. By which disease? Asthma and COPD, chronic obstructive pulmonary disease. We say obstructive lung disease, any lung disease that causes obstruction or cause decrease in the bronchial size. So, resistance to flow in the airway depends on whether the flow is laminar or turbulent, the dimension or the radius of the airway, and the viscosity of the gas. This one, radius, is the most important one. طبعا laminar و turbulent زمان منو تاني؟ okay. Turbulent يعني movement of the air haphazardly. Okay, the diameter is the most important one. Changing diameter will cause a 4 power change in the radius. So for laminar flow, resistance quite low. طبعا resistance كمان laminar flow. أنا turbulent بيك وكوشي. What will happen in asthmatic patient that cause change in the flow from laminar to turbulent or cause also resistance another? Thickening of the lining of bronchial. Cheater. Very good. Mucus. Inflammation. Thickening. Narrowing of the airway. Mucus production. This also causes narrowing of the airway, and also this mucus may make turbulent flow. Mucus because obstruction turbulent flow. مصلكان is contracted. Swelling man a bit. Decrease in the diameter. So asthma is one of the disease that caused by decrease in the air or increase in the airway resistance or decrease in the flow of air. This is asthma. This is asthma or COPD. Asthma or COPD had obstructive lung disease. Asthma is asthma facultatia. The obstruction is not permanent, it's temporary, واني كربويان هي ألم بعزكاتي باشا بعزكاتي هيشيني وقوة نخوشيكي نبي obstruction دائمية. It is not persistent like COPD. While the one with chronic obstructive pulmonary disease, the obstruction is permanent. باش نابن يعني شاك نابن ولا يبكات كنتوا progressive ولا دخلات ثلاثة. But asthma, when they have obstruction, they have symptom. But when there is no obstruction, they have no symptom and they have normal life like other people. So the problem in asthma increase in the thickness of the wall due to inflammation, increase in the swelling due to inflammation. There will be mediator, release of mediator. There will be smooth muscle contraction of the bronchiole, smooth muscle can contract. There will be decrease in the diameter and mucus formation. All these cannot the passageway of moving air will be decreased. حتى mucus ذكر لو أنا بابا decrease passage of air, decrease or in the diameter. So what will happen to the air when flow through? Decrease in the air flow. But the main problem in obstructive lung disease is decrease in the flow. But the main problem in the patient with restrictive lung disease is a man obstructive lung disease where restrictive chair. Restrictive, I will give you an example like fibrosis, like chest wall deformity. What's the main problem? Flow or volume? Fibrosis, volume, there will be decrease in the compliance. So if they cannot expand the lung like normal, so the volume of air in the lung will be decreased or less than normal. So when we say obstruction, you have to remember it's related to flow affected. Irrestrictive, volume affected. Restricted, restricted, there is restriction in lung expansion. Okay, restricted. Restriction in lung expansion, so flow will be affected. So any condition, as we said, associated with bronchoconstriction, bronchoconstriction, bronchus constricted. It's called obstruction and cause airflow abnormality. أقول بان رابول لو قصبات أمامنا بيت. Why obstructive bronchi produce musical sound? What sound بتستكن؟ لا بلا resistance يا بو airflow ونيا. ماشي. Okay. We will come to another subject. Ementas the passive ventilation ونيا. Ventilation يا breathing تشيبو. And respiration part of respiration is ventilation and breathing. But another part we have also chemical respiration, external and internal respiration. External respiration the movement of air or movement of O2 and CO2 between what? Sorbage, alveoli and blood. Our external respiration. Our breathing ventilation between outside and lung. Between movement of oxygen CO2 between lung and blood is external respiration. External. Now internal between blood and tissue. External environment. So this is external respiration. Movement of gas between lung and blood, between alveoli and capillary. باش هوايك باش ما نهمجي. هركاتي إما هوايك باش ما نهمجي. أو يعني تواو كشينيا respiration man, external respiration man. أتوانين بلين هواية نخير بيسمان بتشيترا. We need a proper amount of blood, so we need good perfusion also in order to bring the O2 and give CO2 to lung, bring O2 to other parts of the tissue. So we need good ventilation and good perfusion. خاطر بسبب ventilation يكي باشا يعني أبي الفيولا كمان هواية كباشي تيابه وأبي بلد بزلا كمان بلدي تيابه أبي clotting هبه what will happen? There will be no blood to remove the or bring the O2 to other parts of body and give CO2. So there will be abnormality. So we have ventilation perfusion ratio which should be matched. يعني matched, there should be matching between ventilation and perfusion. أبي هبدو كان مظبوط به، نبي هيك كان بهيك زور به، يعني هيك كان normal به. Any one of these abnormal could have impact on our respiration. So ventilation means amount of air that reaching alveoli per minute. ليك دقة شنو هواء يشتغل alveoli أو بيانجي ventilation. And what's perfusion? Amount of blood reaching alveoli per minute. ليك دقة شنو blood يشتغل alveoli. واي إخوان الأمان ventilation ما بس ما نشيء 4 لتر و perfusion كان يركب 5 لتر داني cardiac output أو واي إخوان. أكاد normally أكاد 0.8. So we have ventilation perfusion ratio which is normally equal to 0.8. What will happen if ventilation affected? أما الفيولايكا هواي بونايا obstructed by for example mucus أو كذا أسماء ياسي OPD mucus أم الفيولاي قلتوا هواي بونايا. What will happen to the ventilation perfusion? There is good perfusion but no ventilation. So what will happen to this? Chile, good ventilation, poor ventilation and good perfusion, the ratio decrease. ماشي؟ شو كذا زانم يعني ventilation كي باشني كلا بشي سروية numerator. So what will happen if we have good ventilation? But the problem in the cardiovascular, we have a clot or embolus that block the vessel that supply the lung or supply that part of alveoli. Clot man here blood vessel. So there is a good amount of air here, good amount of CO2, but cannot good amount of O2, but cannot be removed from the alveoli to the blood, and CO2 cannot be added. So here also there will be change in the ventilation perfusion ratio. It will increase more than often. So we need good matching. يعني بتشابه 0.8 كم تريا زيادة or abnormal. We have some laws, few laws that we will discuss that relate physical law that related to our respiration or gas exchange. We have, for example, Dalton's law. Dalton's law if we have a mixture of gases, the total pressure is equal to partial pressure of the gases. يعني mixture gas يعني استقيمة لهواء من هي ما بيشغل أكسجين. نيتروجين لهم يزورتر نيتروجين ماني أكسجين ماني وشيتر ماني CO2 تيا بس كم كماذا غاز يتر من هي. هل يكلو غازانا pressure يكوي effect يكوي هي لسه total pressure. كذا total pressure كذا شيء. Total atmospheric pressure is equal to the sum of concentration or partial pressure of each gases. Partial? چون partial pressure هر یک لو گازانه بدوزینه. تو mixture کی گاز هست. How we know the partial pressure of each gas? Partial pressure of each gas in a mixture of gases is equal to total pressure multiplied by concentration of that gas or percentage of that gas. يعني لصايا شني مثلا لصايا تاويكي atmospheric pressure تيا nitrogen. باشا ويبزاني partial pressure كي تيا بتشي بكين. أبي لصايا تاويكي تزربي atmospheric pressure كين partial pressure كي دوزين. For oxygen, the same. If we say it is 20% or 21% of the atmospheric pressure is oxygen, partial pressure is atmospheric pressure. This is Dalton's law. And what is diffusion law? Diffusion energy. Diffusion says it's very easy. The gas will diffuse from where to where? From higher to the lower pressure, or higher concentration to lower concentration. باش بشوية concentration زورا أجولا بوكيا بشوية the concentration كمان. What about Henry's law? Henry's law quantify a gas that will dissolve in solutions proportional to partial pressure and solubility coefficient. Henry's law should be we have a gas. This gas, the amount of the gas that transfer is depend on what? Depend on solubility of that gas or the amount of gas that dissolved. Soluble and soluble or gas. We're partial pressure or concentration of that gas. So the higher concentration, more gas dissolved. The higher solubility, more gas dissolved. Dissolving gas. As we said, we have a fluid lining in the alveoli. The gas when the gas transported through this layer, it should be dissolved first. And it also go to blood. Blood is also fluid. The gas should be dissolved. What is Fick's law? Fick's law states that for a gas to pass through a thickness or an area, or there is, for example, a membrane, gas membrane thickness and area of the membrane. Increasing the thickness will cause less flow, while increasing the area will cause more flow. Taku area flow asantrebe, zortrebe. Hataku thickness zorbe, there will be less flow, or the flow affected. And this one is very important. I'll ask you now I'll show you in some diseases, for example. Graham's law. What is Graham's law? It's related to molecular weight. Molecular weight of the gases. Molecular weight of the gases. If the gas has larger molecular weight, there will be less diffusion or less flow. Molecular weight is slower diffusion of it. So, gas diffusion, for the rate of gas diffusion across the membrane, it is increased by what? We need high flow rate, of course. It's better to be a good gas diffusion. In order to get good gas diffusion, O2, CO2 between blood and alveoli, what we need? We need a great area and surface area يكي باش ما نبيها خدنا بين برونكيولا كان شون دعوش بون هر همشي alveoli بيويا surface area يكي زور ما مدروس تكا. We need a good solubility of the gases. We need less thickness, and we need of the respiratory membrane, and we need a greater pressure difference between the two gases. Basi hamashta, to'ata ema boy between hanasabay, the air will come to the alveoli, and the air will pass through the terminal bronchial, and alveoli will come to the deeper layer of the alveoli, and it diffuse by Henry law in the fluid, and then come to the blood. And by the diffusion law, according to the concentration difference, the gas will move from higher concentration to lower concentration between alveoli and blood. Oxygen زورت الهاتو تناوي أو بلدي هاتوا CO2 زورت البير. كاتا CO2 from blood will go to the alveoli. O2 is higher in the alveoli, will come from alveoli to the blood. And so on. Okay. So this is respiratory membrane. as we said, we need good diffusion. One of the factors that make good diffusion, we said, by the Fick's law, we need a good surface area and thickness can. So we need a thin membrane. A membrane is thin, but it's composed of 7 layers. How layer? Thickness 0.5 micrometer. So can thickness 0.5 micrometer. It's very thin, but it's composed of 7 layers. Two layers can. You can fluid lining of alveoli. You can epithelium of alveoli. Another one is interstitium between alveoli and blood vessel. Another one is endothelium of the blood vessel, and another one is طارد والسلقة. طبعا الكابيلاري كمان لقوا الفيولايات شلونها يكسر in contact with alveoli. الكابيلاري يعني they are so small that only single cell line can pass through. يعني يقرب السيل يجي الفيولا. That's why يعني بلازما شيء لبينا يزور كمان. So it is very thin. It is very important for gas movement, for diffusion of gas. يعني أما هيك كلاماني كproblem يزور درست هل هيك كلامانه تكتشف. كيف يا مالا what factor cause affect gas diffusion that's related to the respiratory membrane. شيء كاركات صار gas diffusion ما لقى كيميكاتو زي respiratory membrane كان. كامل لوانه تكتشف شيء كهذا. thickness بلا thickness كنا. What disease that we discussed previously cause affect the thickness? Thickness.
Pulmonary fibrosis.
Pulmonary, very good. If it's pulmonary fibrosis, there will be formation of fibrous tissue. Got a fibrous tissue درست أبي. أو هيك كنا بوزا كان. Emphysema tambire basmanker emphysema. There will be destruction of the wall of alveoli. So surface area decrease. Alveoli وقت كأوهم والله هنا there will be decrease in the surface area. And also any disease that cause edema in the wall of the lung or in the tissue of the lung will cause increase in the thickness. So it affects gas exchange. Another disease, pneumonia, accumulation of fluid inside alveoli. This will affect pneumonia. We have pulmonary edema, accumulation of fluid in the lung tissue. Hashtag either fluid lining fluid or pus accumulated in the alveoli. All these will cause increase in the thickness of the respiratory membrane and decrease in the gas exchange. هالبرنامج بين شو كده تقمان. Okay. كمان معه. Spirometry يعني lung function صار دقيقة يخلين. أم صار ضربة simple تيجي كم تعمل سريبيال. What is spirometry and why it's important? Why we have to do it? Spirometry يعني شيء بيوه measuring spiro يعني respiration كاتون. والdiagnosis what she can. Why we use spirometry? It measures flow and volume. Restrictive and obstructive lung disease. So it tells you if the patient had normal lung function or obstructive lung disease, or it could suggest restrictive. Not one of a diagnosis restrictive. Spirometry shows volume period. You will breathe into the device and you will breathe to the device and breathe in. Device here and I say plenary. Volume lung أخوانته. Volume lung cheer. وتشوف زي volume كان كيميكي دويانا. And it also tells you about the flow. بيعملون spirometry show flow أخوانته. How spirometry measure flow? If you show flow أخوانته spirometry. توفوا كي تنام جهازك ماله ماله سكت طوال بلام راستك بلام شرنية وشي استواني الكزمان هي chronic obstructive lung disease يعني شي يعني due to obstruction they have low flow but if we give them time to expire more the volume could the normal volume يعني volume كلا بكاتو أو volume كمان تالي يعني ناتوانين بوا we have a measure how we know if the flow decrease or increase how we know if the flow is decrease or normal شو بزانين flow تشيا سرعة الروشني هواك the speed or movement of air through the airway بله transducer işi tiyaya rastaki بلام measure اكتمان هنا كشمان يصير بعد بس الأنبولة مكان كي أنا exercise بيستهل متعنا ما بيكنا است normal breathing أو بيسنا بيكنا متعنا breathing كنا جينا ليرن هاي نستوسو هاي نستوس بس هاد normal breathing كنا بس دارنا بدو ما لا exercise كنا okay so است normal breath جيا في ألان tidal volume يعني شيء tidal يعني وكو شابول وكو مدو جزر چیکار هاکشانو دارشانی ای asteroidary هاکشانو دارشان مدو جزر باش اما بيالن tidal volume this is the normal volume اما طبعا كاديو كسه ناس ايا جهازك يا بخوارو اروح خطيك بخوارو when expirate there will be this line when inspirate this line. So this is normal inspiration, this is normal expiration. So this is called tidal inspiration and expiration, tidal breathing. I'm a normal. But I'll ask you a question. Could you inspire more after normal breathing? Yes, they become start. بزعل شنو يتربى يوم normal because it was the بزعل شنو يتربى يوم What is this volume? أوي تفتايدل بدواي أوي تبيالن بيالن احتياط بيالن شيء residual volume sorry reserve volume يعني شيء reserve وكتون يعني كري احتياط ليه بكارين مش احتياط بكاتي بيرستيا بيرسمانا به when I'm for example speaking someone singing during laughing during coughing sneezing لو كانت أنا تبيستبن باشا during as we say blowing a balloon and so on بيستبه هناسي كزورت رحوي مشي so it is called inspiratory reserve volume it is called reserve why because it's only used during reserve during need so this is called inspiratory reserve volume after tidal breathing bash after normal expiration يبقى after that 5 minutes after that see how much you can expire after normal breathing يبقى هذا مش normal normal breathing after that بزانت شنو كتير هوا أكثر شنو ترى تواني أبي بنيش لكن نجمي باش نبي بنيش تسكتون سيري ده أنا سيبروا سيري من ده after that, how much air you can breathe out? How much air you can breathe out? Expiratory reserve volume. This is a reserve that's only used during need. كمحمد إسماعيل فكر دبعونك شي بكار هنا expiratory reserve volume. ولا؟ Bash. After this, is there any air inside our lung? Yes. So we cannot expire of the air from our lung. Bash. So there is air. There will be volume of air that remaining in the lung called residual volume. Residual يعني باشماوة أمانيته ولا نعلم معنا. كواتا definition أمانة آسان لبري مكان. Please. Don't just memorize them. Please learn them. Only do it by yourself, you will know the name of this. This is tidal volume. Inspiration after normal inspiration. How much air you can inspire? This is inspiratory reserve volume. After normal expiration, how much air you can expire? Expirating reserve volume. احتياط. After full expiration, how much air remain in the lung? Residual volume. باش ما منيت ولا لندا. باشا. Do term ما أزانم. We have two terms. One of them is vital capacity. What is vital capacity? The volume of air, volume of air that expire fully after full inspiration. استيك أنا سيقول هالمجن، أنا سيقول فول، همو يبنوا. دي بس بردوام بالموست normal inspiration, normal expiration. بردوام تا residual volume.